Well, good day, everybody. This is Chris back again at the Ancient Scholar, and today I'm going to be talking about the benzodiazepines. This is a very large group of substances, far too many individual substances and subgroups of substances for me to really talk about, but we'll talk about some of the major ones. The general chemical structure of the benzodiazepine is this is they all share this same structure in common. So that's where I'm going to start, and then I'll modify this benzodiazepine structure to give you some individual examples of benzodiazepines. So benzodiazepines are a bit newer than the barbiturates, and unlike the barbiturates, benzodiazepines do not cause um, activation of the GABA receptor. That is to say that they are purely synergistic, um, and they enhance the response to GABA. So they enhance the way that the receptors respond to the endogenous GABA that's in your body. But unlike the barbiturates, they don't actually cause the receptors to open at higher doses. Oh, that's a very different. Their binding site is purely allosteric on the benzodiazepine receptor site on the GABA receptor. Okay, so that's a big thing there. They generally have a little higher safety margin than the barbiturates. They have, for the most part, there are larger dosing ranges that they can be used in. So, to some extent, they are a bit safer. And there is actually a reversal agent out there that can reverse the negative effects or consequences of benzodiazepines to some extent. That is to say, the effects are the same effects that you would see with the barbiturates, CNS, central nervous system depression, respiratory depression. Possible hemodynamic changes as well. However, this agent goes by the name of flumazenil or romazicon. This agent may not reverse the respiratory depression as well as you would expect. And the other thing is, because the benzodiazepines are very similar to the barbiturates, in that they help control seizures. If you have somebody that maybe is more prone to developing seizures and they take benzodiazepines chronically, they're either chronically addicted or maybe they take them as a part of the medicated anti-seizure therapy, anxiety therapy, sleeping, that's whatever. But if they have developed a dependence and even addiction, there is a chance that you could administer the flumazenil to these patients and you could cause them to go into withdrawal, and they could have seizures and all these things that could happen. And then you're in a position where you're going to have a very difficult time managing those seizures, because what is a primary medication that we use to manage, to treat seizures? Benzodiazepines. Okay, so flumazenil is rarely used to reverse overdose unless it's on a benzodiazepine naive patient who is having some sort of procedure done to them, a procedural sedation, and we are the ones administering the medication and there is an overdose situation. Okay, so let's talk about the primary chemical structure of the benzodiazepine. It comes down to this structure here. You should be familiar with this at this point. Right here I have a benzene ring, or an aromatic ring, and then I have a diazepine ring here. Okay, and of course the nitrogens kind of give the diazepam part of this away. So your benzene or aromatic, and then your diazepam part. When I talk about the diazepine ring, the way that I number the positions on the ring is I start at the top nitrogen here, and this is 1, 2, 3, 4, 5. Okay, and you see that I have a nitrogen here at 1 and a nitrogen here at 4, and so a lot of the benzodiazepines that have this structure, we call them 1,4 benzodiazepines. Some other things that are highly characteristic of benzodiazepines is you at the number 2 position here, you often have a carbonyl group. So that's a carbon with a double bond to an oxygen here. And then over here on the aromatic ring at position 7, you often will have a electronegative atom attached there. Instead of your typical hydrogen, you'll have an electronegative atom. I just happen to put chlorine here because chlorine is a common, so this side is going to be more polar, and you'll have some polar here as well. So this is the basic structure of the benzodiazepine, and then what we do is we modify this structure to make individual benzodiazepines. So what I'm going to do is I'm going to show you a very common one that is used and was used very commonly when it first came out for sleeping, anxiety. We still use it today for procedures and sedation and its anti-anxiolytic effects, and that is diazepam or Valium. So what I do is the number 3 position here, I'm just going to add 2 hydrogens here to this carbon. Okay, there we go. So I have 2 hydrogens there. And then what I'm going to do is I am going to add a benzene ring. Let me take my hand off of that. So I'm going to add a benzene ring to the 5 position down here. All right. So I have got me a benzene ring here. And I'm going to add the aromatic ring and pull that back. All right, so now that I've modified the principal structure of the benzodiazepine principal structure by adding 2 hydrogens here and adding a benzene ring here, and now I have Valium or diazepam. Now, Valium or diazepam is often metabolized. It has a couple of different metabolites. It has oxapam and nordiazepam are 2 very common metabolites of diazepam and benzodiazepines. And so I might as well just go ahead and show you guys that as well. What these metabolites, if you will, look like. The oxazepam rather, is an interesting metabolite, and really the only difference between that and diazepam are these little guys here. Okay, these little guys get removed, the hydrogens, and I replace them, I substitute them with a hydroxyl group. Bam, right there at the 3rd position there. Okay, so this is oxazepam. All right, and then there's another metabolite, nordiazepam. And nordiazepam is pretty similar to diazepam. With the exception, and I you know what, I totally messed up, but diazepam also, let's go back to diazepam here, because there's one other thing that I should have had there, and that should have been on this nitrogen here. There should have been a methyl group added to the nitrogen. Okay, so now I have diazepam. All right, now I have diazepam, that methyl group. So I put the 2 hydrogens back on. Okay, so to make nordiazepam, it's pretty much the same as diazepam with the exception of this methyl group here. This methyl group is removed, and I simply have a hydrogen there, and that's nordiazepam. Now, nordiazepam and oxazepam are metabolites that are commonly show up in urine drug screens. They're common urine markers, so it's just kind of noteworthy to mention them. Okay, so now what I'm going to do is Talked about diazepam. Diazepam has a fairly long half-life. It's reasonably lipophilic. But what I want to do now is I want to give you an example of another type of benzodiazepine, and that is the diazols, of which you have primarily two, midazolam and lorazepam. And the lorazepam, midazolam, and diazepam, or Valium, Versed. Some people call midazolam Versed, even though you don't see that in the U.S. You just see it as its generic midazolam. And Ativan is called lorazepam. Midazolam, lorazepam, and diazepam are three of the most commonly encountered benzodiazepines that I see in the emergency setting. So they're the ones I'll talk about. So we talked about kind of the prototype, if you will, and that is the Valium or diazepam. So what I want to do now is I want to show you midazolam. Okay, so midazolam has the same basic structure. I still have the chlorine here, the electronegative atom, but I end up replacing the carbonyl group up top here. All right, with another ring-like structure that has a nitrogen in it and a methyl group. All right, so right where I took that double bond carbonyl group, I have a carbon double bond to a carbon here. All right, and then I have a little ring that comes around and attaches to the nitrogen there. All right, and I have a methyl group that tops the ring off here, so I'll kind of orient you guys there a little better. Okay, so I've got that ring that I added here on the diazepam ring. There's a little ring here, and it's topped up with a methyl group. And then down here on the benzene ring, I'm going to pull this oxygen, or this hydrogen rather, off, and then I'm going to add a fluorine atom. All right, so this has fluorine and chlorine in it. And let me pull back here, and I'll hold it by the chlorine so you can get a better idea of the scope of the molecule. So here's my benzene ring with the fluorine attached, and then I have this little ring here with a nitrogen and a methyl group, and this is midazolam. And midazolam has very potent amnesic properties. You give this to people and they can have amnesia. So this is a common medication that we use for like painful procedures. Somebody has a dislocation, we're going to put their arm back in, or maybe they've been intubated and we want to kind of give them something for prolonged sedation. We may give midazolam. Midazolam can impact the blood pressure fairly significantly. That's been my experience with it in clinical practice. Midazolam also has one of the shortest half-lives of the three agents of between diazepam, midazolam, and lorazepam. This has the longest or the shortest half-life. Diazepam has the next longest, and then lorazepam has the longest half-life. Okay, so there are many other types of benzodiazepines out there, guys. Literally more molecules, and I could spend days making molecules and showing you them, but hopefully you have a good appreciation for the core, the principal structure, and that is the benzodiazepine rings, and what we can do to modify the different groups that come off the rings, and that's really what makes the benzodiazepines. I should say that certain types of benzodiazepines, the 7-nitro-1,4 benzodiazepines specifically, actually undergo they actually are metabolized post-mortem. So somebody can die and there's still some metabolism that can occur with these agents, and we actually can see other metabolites produced post-mortem, and of course that becomes interesting from more of a forensic standpoint. Benzodiazepines and the barbiturates have similar clinical effects. Their biochemical effects are a little differently, and you should be able to compare and contrast those now that I have all the videos up. They're used to pretty much do the same things. The barbiturates have pretty much been replaced by the benzodiazepines, and I should say that where the barbiturates are really good at inducing enzyme activity, so they increase enzyme activity, benzodiazepines are not seen to induce, they're not seen as inducers of enzyme activity. So that's very different from the barbiturates, but both the barbiturates and the benzodiazepines do have a risk for tolerance, physical dependence, and addiction, and there can be withdrawal associated with cessation of these agents, and they can both impact the hemodynamic status. Some other just kind of odds and ends to tidy this up. Some other drugs that we see used that have GABA-like effects. One is GHB. And GHB is derived from, it actually can come out of metabolism of the GABA shunt. Okay, so GHB is related to GABA and L-glutamate. And then there's another drug that's unrelated to those, but I'll just throw it in there for the completion purposes, and that is chlorohydrate. Chlorohydrate is another substance that has central nervous system depressing properties, just like the benzodiazepines, just like the barbiturates, just like GHB. Another thing that you need to be wary of, in addition to the basic structure that we've talked about and the major signs and symptoms, is that these substances may be very common in a date rape situation. Okay, a lot of these can be manufactured in a pill form. You can crush it up, turn it into a powder, put it into somebody's drink. Some of these substances, particularly if they're given high enough doses, can cause amnesia. So it may make these substances a good kind of date rape substance. And this is a problem, and in fact it was a really big problem back in the 90s, where I happened to be going to college, the town that I was living in. There were several cases, and there were some things going on there. So certainly that is a very serious thing to consider from a clinical standpoint, not necessarily a chemical standpoint. But because I am a clinical guy, I feel compelled to talk about some of the clinical issues. Okay, guys, I think this is going to complete pretty much the sequence of videos that the main sequence of videos that I had planned for benzodiazepines and barbiturates. I hope you've enjoyed these videos. Next week we'll be moving on to ethanol, and I'll be doing some videos on ethanol as well. And it does have some actions on the GABA receptors, in addition to other actions that we don't yet understand very well. As always, guys, thanks for hanging in there. I hope you found these videos helpful and interesting.